So, why are people infected or living with HIV more vulnerable to getting some of these STIs? These are the questions that we are looking forward to having answered by Margaret Kingston, who is an expert. Let's now talk to her and find out why or what is the relationship between people living with HIV and also STIs. Welcome, Margaret. Now let's begin with when we talk about HIV. What exactly are we talking about? Let's simply define for our viewers what HIV is and what is the relationship between HIV and AIDS.
Yes. So HIV stands for human immunodeficiency virus, and it's a virus that attacks the immune system. The immune system is how our body fights off infections and how we get better from infections. And this virus attacks that system, so over a period of time our bodies are not able to get rid of infections that we would be able to normally. And AIDS is when you get those infections, but when you also get cancers that are due to those infections. Anal cancer, cervical cancer are two examples of that.
Mm-hmm. And are there some typical signs and symptoms for HIV infection?
HIV is one of those infections that mimics lots of different infections. So when you first get HIV, most people become a little bit unwell, but the symptoms they get are the same as with lots of different infections, so often it isn't recognised as being HIV.
Mm-hmm.
So like any viral infection, fever, feeling generally unwell, sore throat, headaches, sometimes a rash, which will just get better on its own with time. So people often don't realise what's wrong with them.
Mm-hmm. And there is a concern now on HIV and sexually transmitted infections. What is the relationship between the two, kindly?
So starting off, obviously HIV is a sexually transmitted infection, and sexually transmitted infections often happen together. So if somebody is at risk of getting HIV, they're at risk of getting any other sexually transmitted infection as well, and the same the other way around. If you're at risk of getting syphilis or herpes, you're at risk of getting HIV. If the HIV isn't treated and the infections aren't treated, then the infections, particularly herpes, will make a person more likely to pass HIV on when they're having sex with somebody else.
Mm-hmm. Let's talk about the common other sexually transmitted infections that when you are positive, then you are likely to acquire them.
They're pretty much the same as people without HIV. So the commonest STI worldwide is genital warts, and that's important because certain types of genital wart virus also cause cancer, cervical cancer in women and anal cancer in women and men, and other types of cancer as well. So that's very important. Also chlamydia is very common, another infection which often has no symptoms, or if they do then they're not obviously related to the infection. People might think there's something else wrong. Gonorrhea, herpes, very common. And syphilis, also something that's emerged worldwide as a much more, well, it's always been a very important disease, but we're certainly seeing an awful lot more of it of late.
Mm-hmm. And so, Doc, is there a way HIV positive people living with the HIV rather can prevent themselves from getting these other infections?
That's a really important point to cover, so I'm glad you've asked me that. The first thing is vaccination. So vaccinations exist for hepatitis A and B, and importantly for human papillomavirus infection. The best time to get that is before you become sexually active as an adolescent, but it's still a worthwhile vaccination, and up until about the age of 25 or 40, even in men who have sex with men. So that's important. Using condoms regularly with your sexual partners will reduce the risk of nearly all infections. And getting treatment early, because many of these infections, syphilis, chlamydia, like HIV, often people don't know they've got them. The symptoms might be minimal or they might not have any. Then having tests regularly is important. Just get the test and get that done at your clinic when you go for your HIV care, or go to another clinic, or now now you can order these tests online and test yourself at home, and that's a really good idea if you don't have any symptoms. If you think you've got an STI because you've got an ulcer on your genital region or in your mouth or other symptoms of STIs, then go to a clinic. But if you don't, then you can access that testing yourself online.
And would you say the numbers, the statistics for people living with HIV, and at the same time they have these other STIs that you've mentioned, is increasing or reducing? What would you say the statistics are like though?
The statistics show that for the bacterial infections, mainly gonorrhea and syphilis, the rates are going up. And this is because HIV treatment now will prevent individuals from passing HIV on. So I said at the start that if you've got syphilis or herpes particularly, you're more likely to pass HIV on. That is no longer true if you have HIV and you are on treatment and that treatment is working for you, and that means that you're taking it well and that the virus in your blood, your viral load, is undetectable. That will stop HIV being transmitted. So HIV infection rates are dropping across the world because people get tested, which is the most important thing. Can't emphasise it enough. Get a test. Whether you think you've been at risk or not, it's difficult to assess risk. Anybody can be at risk of HIV. So just get a test, and then you can get the treatment and look after your own health, because it will give you a much better life in terms of quality and length of life, but it will also stop you passing the infection on to your sexual partners, to children, in any circumstance. However, HIV treatment, of course, does not prevent transmission of other infections. So we are seeing a big increase in syphilis and gonorrhea, particularly in the UK, where I work.
Thank you so much.
Thank you.